Hello and welcome. My name is Radin Kamal. Today I would like to talk to you about a simple procedure and also a very complicated one actually about the chemotherapy procedure. So, how is a chemotherapy carried out? Chemotherapy is a very common procedure nowadays. A chemotherapy is a safe and well-tolerated procedure, but well-prepared and thorough planned chemotherapy is the top priority for every good medical services. The patient preparation for oncological aspect, we need a diagnosis first. After the diagnosis is established, we need to have a good staging. And after that, we determine the regimen. So in this preparation from the medical aspect is a lot complicated. And you need to have a very good relationship with your doctor and the doctor to you to dig out any sort of history taking. So we can know your history. We do the examination. We do the laboratory examination. After that, we can determine the overall performance status. And also, a well-informed patient has a good psychological preparedness, and also from the medical team and medical procedure preparation. Then the preparation is for the administrative aspect. First, we need to have a medical record and also a chemotherapy logbook so you can document everything from your chemotherapy regimen, when did you take it, etc. And also, last but not least, informed consent. And the administrative aspect, one, you need to have prescription from your doctor, from your physician, to what kind of chemotherapy we have. After that, you need to have informed consent. So you can know and you can understand what you're going to undertake and also understand all the uh, aspect of chemotherapy from the treatment, what kind of things they will do to you, what is the goal of the therapy, what are the risks of complication, etc. And also you need to have a chemotherapy protocol. So we can give the protocol of chemotherapy. After this drug, you need to have this drug. So the chemotherapy is very well structured and also well planned. So after we have all that, where to go next? And this is an example. I think it's a very delightful example. We go to the oncology center. The goal of chemotherapy start with the decision to treat and seek treatment and prevention of cancer, of course. And then after that, you go to the do all the preparation for the medical, oncological, and administrative preparation. It might take some time, but the time to process all the necessary document is what we need to make sure you have a safe and thorough chemotherapy session. And after that, once you are in the chemotherapy session, you uh, will be asked a lot of questions. And don't worry, it's all for you and for making sure that you have a safe and well-structured chemotherapy session. So we will make sure what kind of drug we will have, what kind of regimen will you have, what is your name, of course. They will ask you your name more than once, I promise you. And then after that, they will administer the drug and reporting all the effects of chemotherapy you feel is also what the medical provider needs in order to monitor the chemotherapy response. So you can report everything to the nurses, to the physician. What are you feeling right now? What kind of uh, reaction you have? What kind of, do you have any chest pain? Do you have any numbness? Do you have any tingling sensation? Do you have feeling of pain? That's important, and we can monitor it. So after that, what to evaluate after the therapy? We monitor the vital sign, of course, and also the side effects. There are myriads of side effects of chemotherapy, but we need to make sure and we need to follow it closely. And you can have an immediate side effect like nausea and vomiting, allergic reaction, extravasation of a chemotherapy agent, early side effect, delayed side effect, even late side effect. So this is not a one-time thing. You need to have a very uh, logical and long understanding about side effects. So you need to be evaluated regularly and you need to report regularly. So what do we monitor after the chemotherapy? We have subjective monitoring and objective monitoring. From the performance status, how are you doing? How are you feeling? Are you feeling better? It's your subjective feeling. And also from the objective, we use radiologic monitoring, laboratory monitoring, and pathologic monitoring can be done also. And what is the response? You have many response. You can have a complete response, partial, or you can have disease that is stable, and also you can have a progressive disease. And all of the above will be explained later in a different presentation. So what is the take-home message? Chemotherapy is a long-term process and can be a stressful experience. But knowing the procedure better prepares the patients to adapt to the treatment. And a well-prepared procedure and a well-informed patient is the key to a safe and well-tolerated chemotherapy journey ahead. So I hope this last slide can give you a better understanding about chemotherapy procedure, and I hope it gives you some sort of comfort knowing what you will have, knowing what you will do, knowing what's up ahead. And I hope you can take this to heart and enjoy your chemotherapy session. And I thank you for your attention. See you next time.